Hello, I'm Dr. Michael Nauck from Germany, and I am talking about a role that hormones produced in the gut have in regulating appetite, food intake, and body weight, and how we can make use of this for the benefit of patients with obesity and diabetes. So glucagon-like peptide number 1, or GLP-1, was discovered mainly as an incretin hormone, and that means it has the ability to stimulate insulin secretion whenever the glucose concentration is a little bit higher than fasting levels. But later, a lot of additional functions have been characterized for this hormone from the gut, GLP-1, and two stick out because they are relevant and important. That is cardiovascular actions, that means on the heart and on blood vessels, and they have culminated in findings that in big clinical trials, patients receiving GLP-1-like drugs, GLP-1 receptor agonists, have less myocardial infarctions, strokes, and cardiovascular deaths. So this is really a treatment that saves lives and prevents severe complications. The other additional finding that was totally unexpected when the compound GLP-1 was discovered and described for the first time is that it makes you feel less hungry, it makes you want to eat less food, and people in fact do eat less food when exposed to GLP-1 or GLP-1-like drugs, and that means they have a chance to reduce their body weight. And since patients with obesity and type 2 diabetes very often have the desire to lose body weight, this really offered a new chance to the patients. My talk looked a little bit into the details. So there are several compounds on the market, GLP-1 receptor agonists, and they have variable characteristics regarding pharmacokinetics, long or short-acting compounds, and so the conclusion number 1 was whether you use a short or a long-acting compound, they both have a good chance to reduce body weight to the same degree. The next point I addressed is the variability. So not every person responds in the same way. Some people do not lose weight or even continue gaining weight when they receive these drugs, and others lose like 25 kilograms, which is a very substantial amount of body weight, and we only partially understand why this is so. So one study from Germany indicates that if you are exposed to GLP-1 receptor agonists, some people feel these effects and they eat less and lose weight, and others do not feel the difference and they continue eating like they did before. And they also performed functional MRI examinations to look directly into the brain, and they found signals in those who responded, and they didn't find the signals in those who did not respond. Another aspect is that GLP-1 receptor agonists delay gastric emptying. Some do this for the whole duration of the treatment, so even after weeks, months, and years, they still slow gastric emptying, and others, the long-acting ones, they induce what we call tachyphylaxis. So you have this deceleration in gastric emptying in the beginning, but not in the end. And many people have the naive view that if you eat breakfast and your stomach is only half empty at lunchtime, then you would not eat the same amount at lunchtime. But that does not seem to be true, because you have the same weight loss with the short-acting agents that do not induce tachyphylaxis, and with the long-acting agents that do no longer have effects on gastric emptying after a couple of weeks. And the last aspect was that these agents have the potential to cause nausea, vomiting, and sometimes it's not tolerable and the patients have to stop the treatment. So the question was, does this nausea mediate some of the weight loss? But it's very evident that patients who never ever reported nausea have a significant weight loss, so that this is just an interaction with certain brain areas that tells the body stop eating, eat less, and then of course the weight will be reduced. And the last thing was that we have some novel therapies in this area. One is that despite the fact that all these GLP-1 receptor agonists are peptides, which usually are digested when you eat them, when you put them into the GI tract, now a preparation has been generated that allows a peptide semaglutide to be absorbed from the stomach. So you can achieve pretty much the same therapeutic effect with a tablet that otherwise requires injection. And the last development is that you can not only stimulate GLP-1 receptors, but other gut hormone receptors. And there is at least one compound that has even more effective weight loss and glycemic control compared to a pure GLP-1 receptor agonist. And so the development probably will lead to even more effective agents, both in terms of diabetes control and body weight loss.